right. Well, welcome everybody to our podcast, Bridges to Community. I'm so excited to be here today. I'm Sarah Turcotte, and I work with Bridges by Epic.
And I'm Erica Lab. I am Director of Team Member Engagement and Culture for Epic Senior Living. Thrilled to be here with you, Sarah, and our wonderful guest, Dr. Nancy Burley. Dr. Nancy Burley is an MD and is Associate Medical Director at Tembo Health. Tembo Health is a healthcare leader at the intersection of medicine and technology, driven by quality and patient safety, while focusing on the patient experience and effectiveness of care for seniors. And we're all about the seniors here at Bridges to Community. Dr. Burley has many years practicing family medicine and is joining us today to talk all things Tembo Health. And if you don't know what it is, don't worry, you will very soon. So Dr. Nancy Burley, thank you for joining us today.
Thank you for having me.
Yes, thank you. We're excited to get into Tembo time here.
Yes, Tembo time.
I think it's a really, really neat service that we're excited to talk about and share with our greater community, and can't thank you enough for taking the time. I would just love to jump in, Dr. Burley, and understand, what Tembo offers. I know it offers a number of services focused on seniors, and can you just start by giving a little bit of an overview with Tembo?
Of course, yeah. So we are driven by our mission to really close gaps for seniors in healthcare. And so Tembo started by bringing in some consultants who otherwise couldn't get into, actually it was skilled nursing facilities at the time. And then they really started to see this need for urgent care in senior living communities. And especially during the pandemic, that became very important. And so now we're learning how we can leverage even more technology as we do this, how we can find other ways to check on health and understand things and be a bit proactive for health issues. And then we've also found that we're pretty good at doing that sort of care coordination piece. And so we are moving into a place where we're going to be offering home care for dementia care management for people living at home with dementia to help them and their families navigate that.
Yeah, that's really incredible. And, during, the times of COVID, getting, and seeking medical care was really put to a halt, and it was difficult for many. And, even though it was tough, I think there was a lot of silver linings that came from COVID. So with this program, what are the general population that you're serving with this service?
So we can talk about a couple different services. We'll start with the urgent care. So our urgent care service is really for these senior living facilities. As you know, when people are in senior living facilities, there are staff, and there are also some nursing staff. But things happen. They might happen off hours. They might happen when a resident's physician is not available. And it can be difficult to know what the right thing to do with that particular issue. Say there's a fall. And so sometimes the options are really just to take that person to the emergency room. And while it may be great, that might be exactly what they need, it's also possible that there might be other ways to manage that issue. And we can, with Tembo, having us do virtual urgent care, it really can help us to talk to the seniors and their families and really understand what is the best, safest way to care for that person.
So your Tembo is currently in Epic Senior Living buildings. This is a new rollout for us company-wide. Yes. Explain to folks watching or listening what it looks like, because you said a virtual visit, and so it's pretty amazing the way that it's set up. Can you explain that to our viewers?
Absolutely, and I think it's really important that people hear it and really understand how it works. And yes, we've been in some other Epic communities. We were also in some other communities as well, so we've been doing this for a bit. And so what happens is that if a resident is not feeling well, or there's a fall, and the staff feel that it's appropriate for them to see a Tembo physician, they have ways to request a call. They can go to our website and do it. They often will have an app. There's also a QR code that can be scanned to get you right to urgent care.
So you can use like a tablet or a phone. Okay.
Exactly. Tablet, phone, even laptop. And so what that does, it requests the call, and then within minutes, a board certified physician is on video with the patient.
In real time.
In real time.
Amazing.
Yep. And the other thing, and this is another thing I really love about this, is that we can invite family members to join. And, if I've learned one thing in family medicine, it's the importance of the family and the family unit and the care of everybody, whether it's kids or adults or seniors. But especially for a lot of seniors living in these communities, there are family members who really need to be involved in the decisions. They really understand the desires and the goals of care for that resident. And so it's so nice to have them right there. It's like they're in the room with us.
And often they're the responsible party.
Exactly.
Yeah, that is
exactly.
Especially in the
mind-blowing.
world of dementia. And I mean, not only getting the families involved, but I think for our nurses who are also helping to support our residents, it's not when in doubt, send them out. We're able to connect with
Exactly.
these professionals and really talk this over because, I mean, let's face it, right now, having to go to the emergency room, especially for those living with dementia, it's not an easy experience.
It's not. And so what we really want to do is we really want to try and avoid any unnecessary visits. We want everyone we want to take care of them safely. And sometimes that does mean the emergency room. But in our work, in a lot of our communities, we've reduced the emergency room visit rate in the residents that we're seeing by 75%. So that's huge.
It's remarkable.
It is
Yeah.
incredible.
And you think about, having Sarah and I have been in elder care specifically for a super long time, me much longer than you, but, and one of the major challenges is when you send a resident out to the ER, there are, no offense to the ER workers, thank you so much, we're so grateful for you, but the experience, particularly with people with mild cognitive impairment or dementia, they're coming back with delirium, hospital delirium, or they're just confused from being out.
Environment changes.
It's such an environmental
It's
change.
like transfer trauma. I mean,
Yeah.
these environmental changes really do stimulate difficult symptoms and behaviors with the residents.
Right,
And if they
so-
don't have to
right.
go, why send them?
Why send them? And then on the other hand, can you talk a little bit about, because I've heard some success stories as we've rolled this out, and I know you work with lots of other companies and in the home and stuff, but one of the amazing things that really got to me that I thought was so interesting was like, what happens when your doctors speak with the emergency room doctors, those outcomes, rather than like a facility just sending someone, we're going to call 911, we're sending them out with what we think is going on. Can you speak to that? Because that I found really remarkable, almost as remarkable as the 75% reduction in ER visits. So could you speak to that a
Yeah,
little?
I'm so glad you brought that up because I was going to mention that too. So we don't just say, okay, go to the ER and hang up, right? We say, we think they need to go to the emergency room. Are you going to call 911 or is there someone who's going to transport them? So we find out how they're getting there because we got to tell the ER that. And then we always ask like what emergency room they're going to go to. Sometimes they don't know and we'll have the community call us back and tell us. And then we call and we ask to sign out to a physician and we let them know, where they're coming from, how they're getting there, and what we think is going on and what we think is the issue, why we decided to send them in. Now, when the ER physician sees them, they're going to start their own workup, but I think it's sometimes helpful to hear from a colleague what they feel is going on. The other thing that I do is if there's a responsible party, I always make sure to give them their name and number because I think that can be very hard to find in a busy ER.
Yeah, that's great.
Absolutely.
That's great. And I know our teams are always sending that information, but it does not always make it inside the hospital. So that's fantastic.
Well, and I think having that doctor-to-doctor conversation really goes a long way. It's direct contact. It's not like the game of telephone by the time the message gets there, right?
Totally. And colleague to colleague is like they're speaking the same language.
Exactly. Yeah.
Yeah.
The other thing that I found really interesting with the services Tembo provides is you also offer, and I know we participate with this at Bridges, is the fall detection and vital sign monitoring. I think that is so innovative and would love for you to touch on that a bit.
Yeah. So I think the fall monitors are where the real story lies, but we can talk a little bit about some of those more physiologic sensors. And they can offer some data. We're also looking at how it can offer us information about sleep quality, which is very important for health. We see, changes in sleep quality as people age, in dementia. And so I think that's going to become a much bigger thing that we can work with. But the fall sensors, I heard about this before I came on board with Tembo, and I absolutely loved it. So when you're in a senior living community and residents are sleeping in their own room or in their own apartment, if there's a fall in the middle of the night, it's possible that nobody knows about it until the next day. Whether that resident got up or didn't get up. And it can cause even more problems to have that have happened and have the resident there. And so our fall detectors will detect a fall. We can call the community, say, we've noticed that this person fell. Then they can send staff over there to take a look. And if they think that they need a tembo call, we're there 24/7. So
Right.
even if it's 3 a.m, give us a call. Let us evaluate. You
can triage it.
Triage, and we can make some plans and decide, does this need to go in, or is this something that we can monitor?
And for our Bridges communities, which are Epic Senior Living's wonderful portfolio of memory care buildings, we do check every hour.
Yeah.
And that gives a lot of peace of mind.
But a lot can happen in an hour.
But a lot can happen in an hour. And what an amazing thing for our families to know that, like, on top of those hourly visual checks, we also have this system that can catch this. And so, 55 minutes, they're not lying on the floor for 55 minutes.
Right. And
we
also,
know immediately.
We can see the mechanism, right? We can see, was it a slide? Was it a fall? Or do we have to worry about a head strike? Because these are all pieces of the puzzle.
When it's an unwitnessed fall, absolutely.
Right. So now it's essentially witnessed.
That is
That's
incredible.
really neat.
Yeah.
That is really, really something. And I mean, also to just touch on the sleep portion of it, so many of our residents, if they have a tough night's sleep, it could be the reason why they're having some disturbances with challenging symptoms and behaviors. And sometimes we don't always know why, right? We're trying to put this puzzle piece together. So having that data can really be helpful with how we're engaging and supporting folks during the day.
Right. It's like another piece of the picture that we now have privy to, like that information.
Yeah, this is how we sort of leverage the technology to look at things and try and help even before they become a problem.
Right. I love that. We do a lot of work with McLean, and they do a lot of work with sleep, and we're just learning so much more about the importance of sleep to our wellness and mental health and dementia.
Yep.
Either preventative or helping people just manage better.
Yep.
So that's fantastic. I want to shift a little, if that's okay, and because a lot of folks that watch and lots of the families we're working with currently are still at home.
Yep.
So I know the program looks a little different. Can you talk about your dementia program for the home?
Yes. So after we realized that we were getting pretty good at doing some care coordination, and we also understood that, while we love working with our residents in senior living facilities, there are a lot of people living at home with dementia, and they may have a caregiver who's a family member, whether that person lives with them or not. And navigating dementia in that diagnosis is just very difficult, and it's very difficult for the person who's dealing with it and the family. As a primary care physician, I would have to admit that in my time when I was practicing, I didn't know that much about dementia. I mean, I certainly knew about diagnosis, knew who to send them to, but some of the things that are plaguing these families are more about behaviors that they don't know what to do with, or things that they don't understand, or just not even knowing what resources. And so our goal is to really support the resident and the family with resources, with education, sort of be that person, be that first person to call, that first touch point, and really try to give the caregiver some time back so that they can take care of themselves.
Which is completely our philosophy as well. A lot of the work that you do out in the community and our liaisons do for Epic is that type of support, because there's not a lot of that out there.
Exactly.
And people are completely overwhelmed. I mean, if you're taking care of kids and then also a parent and you have a full-time job, it's overwhelming for sure.
Well, it's, as you shared, people get this diagnosis and it does not come with the handbook.
It doesn't.
And even if it did come with the handbook, I think having someone who has the experience and the knowledge and the insight to help guide them, it just makes it a little easier to support them. And we all know when our caregivers are supporting themselves, they become much better caregivers. We have to fill their cup. And I think it's incredible that you guys even have the resources to educate your families in that sense, because that is really, I don't think, happening a lot in the medical world. Wouldn't you say?
I would agree.
Yeah, as a primary care physician, I would agree. I don't know that I had that knowledge to impart on my families. And now, sure, you can go to the internet, but there's just so much out there. And we get people who will say, we just don't even know where to start. well, don't worry, we'll start for you. We'll curate that information. We'll give you what you need. If it's resources you need to look for, let us start making those calls. Like, you maybe, go take a minute for yourself while we do this.
Right.
Yeah.
And so can you speak to a little bit how someone would pay for that service? What is that? How is that for folks in the home?
Yeah. So in most cases, it can be covered by insurance. They'll have a visit with me for a full health assessment. If there are people at home who actually don't necessarily have a diagnosis of dementia, but maybe there's a concern about it, we can also offer some assessment and help with diagnosis and get that ball rolling. And so that would be paid for by insurance. And then typically what we're doing is we're just sort of managing a chronic condition. And that's something also that insurances will typically, like Medicare will pay for, yeah.
And so if you're home, sitting at home watching this or listening, what are some things you're looking out for?
Yeah. Yeah,
what are things in your partner or yourself, if you're able to notice, that you'd be kind of paying attention to?
Yeah. So I think the other thing we see is there's a lot of like, is this normal or not? What's normal, what's not? And, certainly as we age, we slow down a little bit and our brains get full. I mean, I know my brain is like full of 80s lyrics and sometimes can't hold to somebody's name, but that's pretty normal. But what would be a little more concerning would be forgetting recently learned information. So asking the same questions over and over again, not remembering things that they were just told. So sometimes in the early stages, we'll see a lot of forgetting appointments, missing appointments. And so it's interesting because when I was in practice, I would definitely say that when I had a patient who was suddenly missing a lot of appointments, this is what it would make me think about.
Yeah.
The other thing too is sometimes, if you're going somewhere new, it might be a little bit confusing to get there. That's normal aging. What's not normal is forgetting how to get somewhere that you've gone to a lot of times. And also some of the planning and what we think of as executive function. So another early sign that we'll see is some difficulty with managing bills and bill payment. So you might go in and see that your loved one has a lot of overdue bills, and it's really because they've just really lost the ability to sort of plan those steps.
Yeah, it's so interesting because years ago, we would, people looking at their parents' checkbook was a big indicator. Like, you're looking at the math and you're like, ruh-roh, It's harder now that so much has been, is now digital.
Yeah.
It's harder to know if things are falling apart because sometimes those notices are coming in through email or, so that's been interesting. It's not the checkbook anymore. But I remember, 20, 25 years ago, it was like, oh, I looked at my mom's checkbook and it wasn't, something didn't seem right. And there were checks going out to people that I didn't recognize. And, so I think in some ways that made it harder to figure out what's happening with the finances.
Yep.
Because, you don't necessarily see bills on the counter like we used to.
Well, I will say that some of the caregivers, one of the big things I hear with the caregivers we work is kind of that social isolation. They're no longer wanting to go out and participate in greater community activities that they once did. And that's because they're afraid that they're not able, to keep up with it, or someone might catch on that they're forgetful and they're just retracting from things that they used to love to do. I think that is a really big indicator for family members to have a conversation and really check in, because if someone's been doing it their entire life, why would they stop?
Right. And that's a little different than maybe slowing down and not going out as much. This is like not going to book club anymore.
Right.
Not knitting anymore. What's happening? And and that's a really big one. And it also highlights that we can sometimes see mood changes, but there also can be some cross with depression or anxiety, and both that, sometimes in seniors, depression can look a little bit like dementia, but also sometimes the beginning stages of dementia, when people know what's happening, that can cause some depression, anxiety. Yeah.
Right.
All the more reason to connect and find a provider, because there are things that can be reversible, and then there are other things that you can do to just live with a better quality of life.
Exactly. And that's what we want. We want everyone to really have an enhanced quality of life, while we're helping them with these other things and while we're helping them stay safe at home. We want people to live at home safely as long as they possibly can.
I just gotta say, I think for so many people, the fear of these diagnoses like paralyzes them.
Yes.
And it's really important to know that it can be empowering. You have a diagnosis of mild cognitive impairment, or you're starting to see dementia. There are proactive things that you can do to have a better quality of life. And so you'll get a list of those things.
Yep.
And we certainly at Epic do a lot of education on what are 5 things you could start doing today that are going to make your quality of life better, even if you already have a diagnosis. So to put it off out of fear is a mistake, because you can still do something about it. It's not too late. You can be 101 years old and still do positive things for your health and your quality of life.
Absolutely. And I just think it's even more reassuring and takes out another barrier that people can access this right at home.
Yes.
Yeah.
Yeah. And we're working, again, leveraging technology and, thinking about this sort of cognitive training, that there is some evidence to show that can help with that mild cognitive impairment. And so what things can we offer? What things could we put on an app that people can do, in addition to, I'm sure, the other things that you talk about, sleep and exercise and all those great things.
Right. Yeah. And working together. So whether you're at home and you could benefit from these, or your home is in a supported living environment, either way, Tembo can support you in some way.
Absolutely, yeah. For a lot of folks who are living in a supported community, sometimes the things that we are offering are already being offered. But if someone's in a community and it's not, we can work with anybody anywhere.
Okay, that is fantastic to know.
I think it's incredible. And I mean, what other highlights should we make sure we hit on with this podcast? Because I want to make sure that you are able to share everything that is the best reason to check out Tembo.
Yeah. So I think from that sort of urgent care perspective, especially for anybody listening who's going, what is this? And what? I love sort of just to talk about some of the things that we see. I saw a patient last week, and the staff had noticed that her oxygen was a little bit low. Now, she had some underlying lung disease, and so she did have a tendency to have some low oxygen, but it was lower than normal. She was also coughing, and they're able to provide me with vital signs. And also, one of the nursing staff had listened to her lungs and gave me that. So I love when staff are always in the room when we do these visits, and I have them help me with parts of the physical that I can't do virtually. They push on bellies for me. They listen. It's really this great collaboration. And also the family member was right there on video and was able to say, yeah, this happens to them a lot. And so what really it seemed like an X-ray was probably a good idea, and probably starting some medication. So, but it didn't seem like she necessarily needed to go to the ER for that. So that's exactly what I did. We were able to order a mobile X-ray to come out. But even before that, I felt like it made sense to start the medication. We sometimes will see this if we can collect, like, for example, in a urine infection, we can collect a urine and also start medication. And so that's what we did. And, I got the history from the family member and understood sort of what this typically is and how it's typically treated. Staff also had knew similarly how this is for her. And then by the time the X-ray came back and I called to sort of give the results, she was better. She was getting better.
Right.
So
she's on day 3 or something.
Day 3, and she's better, and she didn't have to go to the ER.
I was going to say, and she didn't have to leave for the ER.
She didn't.
That's great. Yeah, you're cozy in your own bed, getting better.
Exactly. Yeah.
I think there's some other success stories that I know of as well, where a resident or a person did need the emergency room, and I would love for you to share kind of our most recent experience.
Yes, I remember that one. Yeah, so we did. It wasn't me. It was a colleague who saw. I should say that my urgent care colleagues, they're amazing, and most of them are emergency room physicians. I'm the only family physician of the bunch.
Wow.
Yeah, so they're in the trenches. They see this stuff all the time, and they're really good at this. And all of us have a lot of telehealth experience, so we're very used to doing this, in a virtual environment. And so again, with using, having the staff, having vitals, this was a patient who did not look well, but it was not quite clear what was going on. It wasn't very obvious, but it was almost like, we doctors, we talk about our spidey senses, and we have those, we have our gut reactions. And so I think also just virtually we can see how someone is looking and how they're doing. And the doctor said, I'm not sure what's going on, but this needs to go in. And it turned out that this resident had basically a surgical issue. There was part of the colon that was sort of telescoping into another part, something very hard to find. Like, it's not something that's very obvious, but, with his experience, he just knew. And he knew that it needed to go in and, was able to coordinate that. And so we got that person seen. Yeah.
It's really unbelievable. And when you talk about spidey senses, I think one of the most amazing things about this technology and what you're doing is that especially for us, like the collaboration, the real-time collaboration, because sometimes like the daughter will be there either, zooming in or whatever, or in the room with the resident, and we'll be able to say, that's not her. Yep. Or she would never not eat lunch, or, and those types of things. Between that and our caregivers who know the resident so well because they're always with that resident, those are the things that for you all make such a difference because it might not seem out of the ordinary, but then you take it in the context of all the caregivers and you're like, oh no, this doesn't look good. Like, this is how we're going to proceed. And I think that collaboration is key. And if it's 3:00 in the morning, it's hard to get that otherwise.
Yep.
And that's been a huge difference for us, especially that 3:00 in the morning call. It's like you have your, this wonderful nurse on duty or an aide on duty, and they're trying to triage it. But then to get someone in on the phone, and then if they can get the family member, you have like 4 people working on this. It's like that's when you get your best outcomes, is the collaboration.
Exactly, 100%. And I rely on the staff who know these residents. And when a family member pops in on the video and goes, oh, that's not how she usually is. It's like, I'm like, oh, thank goodness, just because it's so great to have that. And that's what I used to get in the office, right? I'd have people coming in, whether it's the wife dragging the husband or someone coming in with their parent or their child, they tell the story.
Right.
And so it's really great. And and I've done a few webinars for the families and for the residents, and all of the family are like, call me at 3:00. Like, you can call me at 3:00. And I'll just do a little plug. I believe I'm doing another one next Wednesday.
Great. Thank you.
Yeah.
Well, just to wrap things up, do you mind just sharing with the audience what inspired you to do what you do? Because being a physician, it's a hero line of work, and I would love to just share your story if you don't mind.
Well, I've mentioned that, and you mentioned that I have my background is family medicine, and so for many years I was a primary care physician, and just loved being with the families. But changes to primary care, and then the pandemic actually led me into telehealth. And in telehealth, I actually found I could spend more time with the patients, which was really interesting. There wasn't anyone telling me how many patients to see or how quickly to see them.
Interesting.
And then I was just drawn to Tembo and this idea of really filling these gaps. Our CEO, his grandfather was in an assisted living facility, and they found that he was being transported to the ER almost on a monthly basis just for changes in condition that didn't necessarily need the ER. And he thought, there's got to be a better way. There has to be a better way. So being able to be part of these solutions, I came on and really started digging into this dementia care and working more on these sensors. And it's just game changing.
No, this is incredible. Thank you for sharing that story. Dr. Burley, we're so happy to have you here and can't thank you enough for sharing about Tembo. And I just can't wait to see your continued success and how you're helping, residents and families alike.
And we'll get your website up there so people can reach you. Thank you so much.
Yes. If anyone has any questions or wants more information, they should just go to the website.
Fantastic.
Yeah.
All right. Well, thank you so much for joining us on our Bridges to Community podcast, and we hope to be back soon.
We'll see y'all soon.
Thank you.